Hello, my name is Vijay Chopra. I'm director of the heart failure program at Max Hospital, Saket in New Delhi. I'm also the founder president of Heart Failure Association of India. Recently, we have a landmark trial by the name Fine Arts, which explored the role of finerenone in patients with heart failure and preserved ejection fraction. As we know, we have plenty of drugs available for heart failure with reduced ejection fraction, especially in the last few years, and the so-called four pillars of heart failure with reduced ejection fraction are widely in use. But till recently, we didn't have many drugs to take care of patients with heart failure and preserved ejection fraction. Till recently, it was only diuretics and management of comorbidities. And then along came SGLT2 inhibitors, which have established their place in heart failure with ejection fraction not only reduced but mildly reduced and preserved also, and they have become a class 1 indication. We also learned from analysis of sacubitril valsartan trials that ARNI can be used in patients of heart failure with mildly reduced ejection fraction and preserved ejection fraction up to an ejection fraction of 57%. But still there was a vacuum. The previous trials of heart failure with aldosterone antagonists were largely negative. Then came along finerenone, which is a non-steroidal mineralocorticoid receptor blocker, and this trial is a large trial which was carried out to explore the role of finerenone in heart failure with mildly reduced and preserved ejection fraction. Over a follow-up period of 36 months, there was a significant reduction in a combined endpoint of heart failure hospitalization and mortality, which was dominantly driven by a reduction of heart failure events. The quality of life also improved and the patients felt much better. So based upon this, it appears that finerenone may get approved either class 1B or 2A indication for patients with heart failure and mildly reduced and preserved ejection fraction. In addition, finerenone has also demonstrated its ability to improve renal endpoints, and we know that renal endpoints are extremely important in patients of heart failure with preserved ejection fraction and mildly reduced ejection fraction also. Several trials have previously been published in which finerenone was tried, Fidelio CKD, diabetic kidney disease trials. They were all positive, and in some of them the trial had to be stopped prematurely for overwhelming superiority. So it appears that finerenone is an extremely promising molecule. It promises to take care of patients of heart failure with mildly reduced and preserved ejection fraction, and also help in patients with diabetic kidney disease in improving the outcomes.